French, I'm the division manager for Braun Intertech, and I'd like to welcome you guys to our COVID-19 roundtable. I'd like to introduce you to our panel today. Andy Adams, welcome to the panel. You can say hi.
Thanks.
We also have Lori Siegelman.
Hi, Lance. How are you?
And Nick Foreman, back again.
Howdy.
So I want to introduce, talk a little bit about our experts for today. Andy Adams is our CHMM. He has a BS in Environmental Science from University of Kansas and also a Master's in Environmental Health, an MBA, and has 17 years of environmental consulting. So, Andy, thanks for being with us.
Yep, just means I'm old.
Yeah. Lori is our industrial hygienist. She has a BS in Radiology, Health Engineering from Texas A&M, of course, an MS in Computer Science and Engineering from Louisiana Tech, and an MPH in Health and Safety Management from Tulane University. And she's been with W&M for over 10 years. So thanks for being with us, Lori.
Thanks for having me.
And if you've been on any of our webinars before, you probably already know Nick Foreman. He's an MPH in CSP. He has a BS in Biology from Texas A&M and an MPH that's Environmental Health from Texas A&M HSC School of Public Health, and has been consulting for over 13 years. So welcome.
Three different schools of public health. Never before have they been so important.
Right. 2/3 from Texas A&M, because I'm sure that's where is the most important, I'm sure. So
right.
Okay, so we want to go over the agenda for today. We're going to be talking about related industrial hygiene consulting and cleaning and disinfecting plans, disinfection oversight, post-disinfection evaluation, and also facility access and screening. And so we're going to dive deeper into each of these. So Andy, I'm going to kick it off to you. So take it away.
Yep. Great. Thanks, Lance. So, along the School of Public Health thought, probably never before has the reintroduction of workers been more important on the health and safety side of things. We're going to, in the next couple months here, bring, I think at the moment, something like 82% of the United States is sheltered in place, and we're going to start bringing those people back into workplaces. And certainly when we do that, we want to protect workers. They're probably the most important resource there is out there. We want to have clean facilities, and so it becomes a question of how do we do that. And looking at that, Braun Intertech, it's just as important to us as we try and sanitize our facilities and keep our workers safe. So as we work through this with the barking dogs and everything at home, I'm going to let Nick start to discuss some of the services that we're looking at and that we're doing internally, and how we're going to move those to the external side to try and help get this country back up and moving.
Sure. So Lance, you want to go back to that slide you were just at a second ago? So the old adage from Benjamin Franklin is an ounce of prevention is worth a pound of cure. And that's the approach that all public health officials take. You're better off to proactively approach it and to get a game plan and plan from there as you start implementing policies. So what we've come up with and what we are offering to our clients is a cleaning and disinfection plan. Cleaning is the first part. It's very important. You have to make sure that the surfaces are clean before you start disinfecting. Otherwise, the disinfectant is not going to be as critical or effective as it is. So everything from, right now, it's kind of like a phase one right now. Phase one is there's very few people in the office. So you have general safe work practices that you need to be doing, wiping down the common touch points, making sure that you're not going in and touching other things that other people have been touching, and making sure you're exercising social distancing, right? So that focuses on the prevention right now while there's not that many people in the office. But as we move into reintroducing the workforce, you're going to have not only the surfaces that you're touching and the items that you're touching, you're going to have more people in the office, right? So you can't just count on disinfecting the surfaces. So what we can help there is we can come up with basically a roadmap, a cleaning and disinfection plan that will help you in the various stages of the reintroduction of employees or the various processes that you do. Say you have a large fleet, we can identify ways to help you clean and disinfect your trucks if you've got communal trucks and that kind of stuff. So we can look at your processes and see what you have going on and see if there's anything, and come up with a cleaning and disinfection guide for what you have doing. We also, as part of that, will take into consideration the PPEs that are required or optional. If you're just cleaning up after yourself in your private work area, you might not necessarily need gloves to disinfect your office. But if you're cleaning up after a large meeting or a break room, it's probably a good idea to go ahead and throw gloves on and maybe a mask and that kind of stuff. So we can walk that through with you guys, figure out what you guys want to focus on and what your processes are, and come up with a hazard assessment as far as going in and cleaning up after your employees. And obviously this will all be based on CDC and WHO recommendations and guidance.
And I want to jump in here quick, whether it's us doing this, whether it's another consultant doing this, or whether it's you doing this, all of these folks need a plan because this isn't over and it's going to continue to be an issue as we reintroduce.
Yeah, because I'm sure that you want to make sure that you're cleaning and disinfecting properly, because if you're not, then all you're doing is spreading contamination from office to office or from place to place.
Right.
Totally.
So one of the things that we will go over, and we can go over with you in the cleaning and disinfection guide or plan, is talking about common touch points in the office setting. So here you're looking at this, it's kind of a representative picture here, but if you look deeper into it, if you're disinfecting all of the common touch points, you've got a lot to clean up after. So Lance, if you want to go ahead and hit the animation, just off the top of my head, this is stuff that we need to make sure that that you're disinfecting. It's keyboards, it's mice, it's phones, it's controls for TVs, it's remote controls, it's markers for the whiteboard, it's all the headsets that these guys are using on a day-to-day basis that are common touch points that you typically will see. Thermostats, light switches, all that kind of stuff needs to be disinfected on a routine basis. And based on what your office scenario is, how big it is, how many people you have in the office, that's something that you'll have to take into consideration. So they're hidden everywhere. So
this really gets into people, right? We can clean surfaces, and if we have a plan and we work those surfaces are pretty easy to disinfect and clean. Now, and I think probably some more perspective here from Lori as well, but people and density and spread has seemed to be the real issue with the contagious part of COVID on the side of comparative to the flu and comparative to some other things. And then maybe it's not as contagious as something like measles, but there's, along with the plans, then there has to be an idea of how workers are going to get reintroduced, because they maybe are the wild card.
Right. So as you do introduce your employees back, there's things that you can do, like say in the picture before where everyone's crammed into one small area, maybe you reorient your tables so that it's a smaller number of people at each table instead of having one long avenue of people in one small workspace, or maybe you have every other office filled for a little bit, that kind of stuff. So that, like Andy said, the wild card really is going to be how the employees, are they social distancing still? Are they taking the disinfection seriously? That kind of stuff.
this slide is just a little bit of a comparison. You see COVID there down on after influenza and Ebola. So this again just gets into RO and the ability to spread, right? So it is more contagious than influenza and Ebola. It is less than mumps, rubella, measles. Measles is the classic one here, right? Measles, like if one person gets it, 18 people are going to get it from that person.
Wow.
And it's exceptional at its spread. And the flu, which we all think of as very contagious, isn't probably as contagious as some of the other things out there, which I think is potentially why some folks have been underestimating COVID's ability to spread, quite honestly. And then, as I said, it isn't just about wiping those surfaces down. It's also about the sick person that maybe is asymptomatic, figuring out that they are a potential carrier sooner than later.
Andy,
Sure.
I've seen in some reports that it's also called SARS-CoV or coronavirus 19. Is that accurate or
Yeah.
okay?
So SARS is severe acute respiratory syndrome, which is the actual effect that the virus has on the body. And so SARS and MERS and COVID are all in that same coronavirus family to some degree. And so that's why the SARS names comes with COVID. COVID-19 is actually the symptoms that it causes are called COVID-19. The SARS-CoV-19 moniker is, I think, the actual disease name, Nick, and then the coronavirus is the type of virus that it is.
Right, that's my understanding as well. Yeah.
And novel is it's the first time it's been identified. So the novel coronavirus, meaning it's the first time this coronavirus has ever been identified in humans, at least. Good times.
Yeah. So getting back to, developing the cleaning and disinfection plan, the break room is one of those areas. And Lance, if you want to go ahead and hit the next animation, looking at this, it doesn't look all that bad. And then when you start thinking about the common touch points, each one of those handles, I think I counted something like 18 just in this picture alone, are touch points that you're going to have to take into consideration. Things like the backs of chairs where everyone grabs a chair and moves it and backs it in and out so you can sit in it. Those are all common touch points. Things like the dishwasher handles, the sink handles, the sink itself. Everyone gets in there and does the dishes. So there's a whole lot of areas in a very small amount of area in communal areas like a break room. And then the next slide is, everyone looks at this and you see it and you may go to it 3 or 4 times a day, a person. But, we had an instance here in our office a while ago where there were 3 or 4 of us waiting in line. And as the first person went up and did this, they touched the buttons and we all hit enter and we all hit, copy twice and that kind of stuff. So each one of these areas is going to be some of those communal touch points that you want to make sure that you disinfect on a routine basis. And then the next,
it's really amazing if you start looking at just the commonality of these touch points. Now, the best thing is if you have discussed with your cleaning agency and they know your wishes. And so to give you an idea, I mean, there are airports that are spending an extra $5,000 to $10,000 a day cleaning this kind of stuff. And so I'm not telling you that your business is going to do that, but I think to have a conversation with your cleaners and get them to start understanding cleaning these surfaces is a good move on your part. And then you also have some, like Nick's going to discuss now, some common places or fleet things that will be hard, and people are going to have to take some personal responsibility on some of this.
Right. So for Braun, one of our biggest concerns right now is we have a large fleet of pool vehicles or vehicles that are shared among employees, right? So in our circumstances, we've gone to no more than one employee in a truck unless it's absolutely unavoidable, right? So if you're driving 10 minutes to the site, we'd rather you take 2 trucks just to be safe. And if you look at this diagram here shows that you're exercising social distancing. Obviously, if you stick another person inside the cab of this truck, you open up a whole new avenue for common touch points that you'll have to disinfect. So like Andy said, it's going to be the responsibility of your cleaning crew to some extent, but a lot of this is going to fall in the hands of your individual employees. And every time they get out of the back of that truck or out of the cab of that truck, they need to make sure they wipe off or spray off the areas that you're looking here, the common touch points.
And get that outside door handle that everybody touches to get in the
Right.
thing.
Right. Yeah.
So I mean, not only are we going to be having disinfection plans and cleaning plans, but they're going to have to train everybody, a whole new, set of rules to, if you're going to take a truck out, like, hey, you need to make sure that you wipe down, going in and going out probably, right?
It seems like an easy concept, right? And I think people take it probably overtly too easy, that we just need to be cautious and clean and disinfect things. It's a lot more complicated when you get down to it, because you have to have training, you have to have identification, you have to have understanding of exposure. And I have BS 2-degree scientists working for us that we've had to explain exposure isn't just a one-time thing. It's, it is duration times intensity, and that matters. And so it seems easy, right? And everybody says this during flu season or during COVID season at the moment. You just need to disinfect and you need to stay clean, and it's just not that easy. You got to stay apart from each other. You have to clean the surfaces. You have to limit the exposures. And it seems like that would be second nature, but it's not. And so you're going to have to talk to employees. You're going to have to train on your plans. You're going to have to let them know what the plans are.
Right.
I think it's great to make a plan up and have one and say you have one. Now you got to use it, because using it will be what keeps people safe and not sick. Lori's in a little bit is going to get into dwell times and disinfectants and all kinds of other things that are technically exceptionally important, but without people understanding that those things exist, it's all for naught on that side of the world.
Sure. So the last couple things that we typically include in one of our disinfection and cleaning plans is that we can work with you to identify ways to screen and implement a contractor and employee notification policy. What happens if you do have someone come into your facility that starts coughing up a storm or sneezing up a storm, whatever it is, has a temperature above 99.3 and has all the classic symptoms, but still comes into the facility? What do you do? Who do you notify? And what can you do to keep that person from, entering further into your facility, that kind of stuff. So we can help you with all that. We can help you stay away from potential HIPAA violations. We've seen a handful of these now, and we've got a library of things that we can use as references to make sure that you're not overstepping any I guess legal requirements or hindrances. So but then this also gets into you're keeping your contractor safe and you're keeping your employees safe, and we can help you establish an outline on how to do that. Another thing that we've offered is third-party review. Say you've got a plan, or say you had someone come take some samples. We can do that. We can take a look at it, make sure we agree with it, make sure it makes sound science. Right now, you're seeing a lot of businesses pop up, and probably in 2 or 3 months, you'll see a lot of those businesses fall by the wayside. So you have to be careful and use reputable sources for your work.
Well, and I think a lot of people are going to look at this at the start and suspect this is maybe a little overkill. and it might be for your kind of business, right? I think it depends on who you are and what you do. If you're a group that works away from the office all the time, you might not need to do this. But meanwhile, I bet your employees are going to have this done to them quite often. I'll give you an example. I work for a petrochemical terminal that has truck drivers in from all over. And so, you know, on the 5th truck driver that's coming from a chemical plant from New Orleans, where there is a pretty drastic outbreak coming into where I'm at in Houston, they had to start considering if that was a good thing or a bad thing, and if they were going to continue to let those folks in. And at that point, there needs to be some kind of a true plan for that, right? And there needs to be a notification if. And so you see two of the biggest rivals in this country right now, Apple and Google, are actively working on a way to try and notify people if they've come into contact with somebody affected for the coronavirus. And it really comes down to how this country will open up, right? It's testing and it's tracking of exposure to the coronavirus, because you can't have the same outbreak that could potentially overwhelm a hospital system again. And so we have to be vigilant on that. But, you know, like I said, I think at first glance, some people might shake their heads and identify that they probably don't need this. And I think as they think about it more, when somebody infected comes into close contact with 3 or 4 of your employees, you're going to want those employees, 1, to know, but 2, you're going to want them to know and probably quarantine. And then more importantly than that, you've got to worry about a whole outbreak at that facility. And so, like, at the moment, Smithfield has shut down their facility that employs about 2,000 people in South Dakota, and they have between 300 and 400 corona or COVID cases. And the sad part of that, you know, isn't just that they had to shut down. It's that 3 or 4 people by the stats are probably going to die. And they have probably a bigger problem in the fact that there is a whole bunch of exposure beyond that. And so, you know, that's one of those things where you wonder if a screening process might have stopped that person or people from coming in. And, you know, that's where this becomes applicable.
Andy, what about, you know, and it's just fascinating to me that you can actually have it and be asymptomatic. So how do you you know, weed those people out, or how do you find, you know, that I have it, I'm contagious, I'm spreading it, I have no fever, I have no cough, I have nothing, but
also why I think they suspect COVID is so cogent at spreading itself, because there are just asymptomatic people. There are a number of cases where pairs of people, spouses, become impacted, and one is on their deathbed and one is largely not even impacted, yet they both have the coronavirus. Underlying health issues are a huge part of that, but that, Lance, I think is the real sticky part. If somebody comes in with a fever or cough or known exposure,
easy.
It's pretty easy to screen them, right? When they're asymptomatic, problematic. And I don't know that that you're going to fix that problem until other people get sick and you know that there's something going on.
I'm going. There we go.
This also gets into, we probably covered this a little bit, but if there are screening questions that you don't have the workforce to ask or access, that's something that that we could potentially help with. Also, those screening questions together probably with your HR or others. You know, that's where you have to have documents and agreeable documents for everybody.
So Andy and Nick, so when we're talking about, like, we in our office in Allen, we have a cleaning service that come in over the weekend, and you clean the office. I'm not sure how much of a deep clean disinfection jobs that they've done, but so now we talked earlier, before about the new norm. Is that going to be the new norm? Is like every weekend a deep disinfection clean is going to happen every office around the country? Is that kind of what we're looking at?
Well, so I think it kind of is situational here, right? So if you've got an office of 5 people and you're in your workspace most of the time, doing the routine disinfection, cleaning up after yourself, disinfecting after yourself is probably going to be most of what you need to do, right? You may periodically have a deep cleaning or whatever. But if you are an office of 60, 70 people plus, and you've got interaction places, you've got conference rooms, and people are using those in and out, yeah, you'll probably end up having to need your crew do a more thorough disinfection. But that also comes back to making sure that your workspace and your common spaces are accessible for them to do. Most cleaning companies aren't going to go through and say, okay, this is a work file, move it out of the way, store it over here. And I'm pretty sure if someone tried to do that to my desk, they wouldn't have any idea what to do, right? So we've asked our employees to make sure that they have all the excess stuff off of their desk, all the trinkets, all of the paper stacks, as much as possible, so that the clean crew can get to it and can disinfect. And it's a conversation that you will have to have with your cleaning crew, making sure that they know, okay, this is an okay space for you to go ahead and do a deep cleaning, as opposed to the individual areas or the individual offices or cubicles. Those are mainly going to be dependent on the employee to clean up.
Gotcha.
Well, and think about a place like WeWork or an architecture firm that's a little more forward thinking. Think about all those small shared conference rooms that people are supposed to go make phone calls and things like that in. I mean, I like the thought of how we're going about it, but and that's a huge risk area for getting other people contaminated. So we've talked a lot about disinfecting and sanitizing, and so I think I don't want to spend a ton of time on this slide, but I want to talk a little bit about the smallest circle that enveloped viruses there in the green. So greener, smaller, easiest to destroy, or most susceptible, as they call it, to disinfection. So the COVID virus is an envelope virus. The coronavirus is an envelope virus and belongs in that group. And so you're going to see one of the things that we've looked at for an idea about disinfection is to look at bacteria, which is the next step up. So it's more difficult to kill than enveloped viruses. And so when you go up from here, you have fungi and non-enveloped viruses, and you see some examples of what those are. But the bigger story is here, and we've discussed this a little bit. Corona is not hard to kill when it's outside of the body. It's actually fairly easy to sanitize if it's on surfaces. It gets much more difficult when it gets inside from the obvious observations that are going on at the moment in this country.
So,
and we're going to come back to this a little bit on the bacteria side of things, but go ahead, Lance.
I'm
got
sure
a question?
I'm sure that Lori's probably going to get into this. So, okay, so household items that we have are Lysol or our Microban. I bought a Microban aerosol can, and it says kills 99% of virus and bacteria. Where does that take me on this chart? Does it take me to just the first two circles, the envelope and the bacteria, or does it go all the way to, I don't know. I guess I should, that's where I.
So we'll get into a little bit of this, and Lori can probably comment on some of the disinfections and dwell times. And So that 99.99%, Lance, it depends on what it is, what the disinfection agent is, and how long your dwell time or application time is, right? And so as a general rule, up to that non-enveloped virus, most things are pretty effective at sanitizing below there. When you get into mycobacterium and bacterial spores, you start to get into bad stuff that you have to have specific things to.
Yeah, if you have anthrax in your office, it's time to put down the disinfector and get out.
Yeah. But Lori,
Right.
you want to talk about endless and some of those things as it pertains to that?
Right. So EPA has published lists of different types of approved chemicals, or registered rather, not necessarily approved, but registered chemicals that are registered to do certain things. And so the CDC and World Health Organization and other agencies have been referencing the N list that EPA has. And last I checked this list, it was up to about 350, almost 400 different registered products that were deemed to be effective in disinfecting against this type of virus. And on that list is common household things. Bleach, dilute household bleach works, 70% alcohol, hydrogen peroxide, Windex disinfectant cleaner, Comet disinfecting bathroom cleaner. So you know, the common household cleaners, including that one that you mentioned, Lance, that, what is it, Lysol or whatever that you spray now, not having recently looked at the list of ingredients on that, I didn't right off see that on that N list that I was looking at, but pretty much any disinfecting agent with the proper ingredients is going to work for disinfecting. I mean, as you saw in the chart, in the slide before this, it's pretty easy bacteria or virus to kill. So if you clean your dirt and debris off your surfaces, and especially paying high attention to the frequent high touch points, knobs and buttons and things, I think you'll be fine. And I think the CDC also has agreed that it's a relatively low risk, the touching. So the contracting of the virus from touching a surface that has contaminated is relatively low risk compared to the airborne transport, and being in vicinity of people who are contagious is much more risky. So we want to address that certainly, but the cleaning part of it is also important, and it gives your employees a sense of confidence when they're going to come back to work that you've done things to protect their health and safety, and they're comfortable coming back to work.
I think you might want to pop back to that last one, Lance. Lori, I think fair enough to say you're probably the best one to go over some of the cleaning and disinfection side stuff.
Yeah.
And the sort of the varication that we're looking at, and then maybe Nick can jump in on the technology side a little bit.
Sure.
Okay. Yeah, right. It seems simple enough. I think Andy you were saying earlier that you know, cleaning and not touching things, and it seems like it would be common sense. And to a large extent, it is common sense when you can wipe something down and spray some spray on it or clean it appropriately. But when you're talking about something as important as bringing your workforce back, your facility has been closed down, or your office has been closed down, and you're bringing your employees back, and in particular, if you've had an employee that was sick, or the potential for that they had occupied the space and now you want to clean that space, if you have, whether you do it yourself using your own staff, or you hire a cleaning contractor or a janitorial staff, if they have appropriate training, if they use appropriate methods of cleaning with an appropriate cleaning agent, it should be fine. And that's perfectly capable of reducing the infection risk, you know, from contamination of surfaces. but some oversight might be very helpful in this cleaning and disinfection, just an oversight, again, to give the workers more assurance and feel safer about coming back to the workplace, to make sure that from a verification standpoint, that post-cleaning verification, and then also during the cleaning process, are the people that are doing the cleaning, are they following the protocol? Are they cleaning the correct surfaces? Do you have a checklist or a plan in place that identifies the touch points and the surfaces that are more risky, that need to be treated more carefully or maybe double sanitized? So depending on your workplace, you might want to have a checklist. You might want to have that oversight there to make sure that the people doing the cleaning are actually following the checklist, cleaning the materials and the surfaces per the protocol. They're mixing the disinfectant properly if mixing is required. For instance, if you've got a bleach solution or another disinfecting agent that requires some sort of dilution, you want to make sure it's done properly. You want to make sure it's applied properly. And what method and technique of cleaning is most appropriate for that application. So you have to consider what is the surface that you're trying to disinfect and what disinfecting agent are you using. And with those two combined things in mind, do you spray it and then wipe it off? Do you spray it and let it sit for a certain amount of time? Do you spray it on a rag and then wipe it off with the rag? There are a variety of different methods depending on all of these things I just talked about. So you want to make sure all of that is planned in advance, and your cleaning contractors or staff know what they're supposed to clean, how they're supposed to clean it, what is the techniques to use, and dwell time. If you're wiping a surface, spraying it, and then wiping it or whatever, you want to make sure it stays wet for that appropriate amount of dwell time. Depending on what your disinfecting agent is. If it has a dwell time of 5 minutes or 2 minutes or 10 minutes, you want to make sure you apply that product in such a way that it will stay wet for that amount of time, or else you're basically, wasting your time doing that.
So
of course, clean it first.
Sorry. So if you're spraying and wiping, that may not have any effect at all.
Certainly it would help clean the surface, and I don't know that it wouldn't have any effect at all. But if you have to assume you have some kind of viral contact or viral contamination on your surface, and you just wipe it off a little bit and it's dry all of a sudden, you don't follow that proper dwell time, you can't be sure that you've killed all of the contamination there.
Okay.
You need to follow the directions for whatever agent you're using.
Let's chat a little bit about people that are using Lysol wipes and they're trying to conserve and do things like that. But meanwhile, it's important that when you use that Lysol wipe that there's a wet surface after, right? And you can't use it 10 times and have it effective. I understand you want to conserve, but to Lori's point with dwell time and wetness and application, once you're not getting the surface wet anymore, it's time to change out Lysol wipes and get a new one.
Right. And I had done that myself. Actually, I had my little wipe out and I was, doing all the door handles and light switches and things. But after a few minutes and a few wipes and handles, then my wet wipe is no longer wet, so it's really not doing any good. So you need to keep that in mind. And then some post cleaning verification, and I think Nick is going to get into this ATP swabbing business, but I must say just a qualitative verification. Just checking compliance with the recommended methods, that the proper disinfectants were used, and that you inspect your surfaces for dust, ensure that all the dwell times were followed, and just that visual verification. Maybe use a like the white glove finger test on some surfaces. And if your white glove or your white cloth comes back with dirt on it, you know that there's that surface that hasn't been effectively cleaned and most likely not effectively disinfected. So that visual verification that proper methods were used, that surfaces really were cleaned, I think is going to go a long way toward reducing your risk of surface contamination issues.
Right. Yeah, so one of the things that you mentioned, Lori, that isn't on the slide, and so I'm glad you mentioned it, is the white glove test or the white finger test to see if it's even been properly cleaned before you disinfect is very important, because if you go through and you wipe an area of a surface and it comes back and you've got dust and grime and all that kind of stuff over there, it hasn't been disinfected. So that's very important to know. It's very important to document, and if you are going through the steps of getting this disinfected and documenting that you've disinfected it, right? So we've borrowed a technology from the medical industry and then also the food service industry, the food preparation food service. It's a technology based on ATP. ATP is a molecule or a protein that's in all living organisms. It focuses mainly on, at least our technology focuses basically on the bacterial side of it, which goes back to the slide earlier, that if we can kill the bacteria, we know that we're killing the virus as well. So we've got a couple meters that are in use now that say, okay, we'll wipe this area, and we can do it before the disinfection. We can do it during the disinfection. A lot of times, if it's a large area or a area with a lot of nooks and crannies, we're going to recommend that you do at least 2 rounds of disinfection, right? So we can do it between, before the disinfection, after round 1, and after round 2. And make sure that we're getting the return on the disinfection that we anticipate, right? So we can do that, and we'll go over a little bit more about that in the next slide. And then obviously the tried and true test is the bacteriological sampling, send it off to a lab, get a culture count. Again, that's still kind of secondary. There's not a virus specific tests out there, but this will take a look at the bacterial counts, and if you've got less than whatever the standard is for that surface, that number of colonies per cubic inch or square inch or centimeter, whatever the lab runs, then we know that you're effectively disinfecting the process or that surface for the virus as well. And then this is just the ATP testing that we're doing right now. It's a secondary measure of cleanliness. It's very quick. So unlike the bacteriological samples where it could take a week or more to get results back, this is almost live time. You get a response within 15 to 20 seconds by the time you grab the wipe or the swab, I guess, get your surface, swab it, stick it in the meter, and 15 seconds later you have a result based on the chemical reaction between that ATP and their reactant, I guess, and you get a result right then and there that gives you an indication of how clean the surface is. So it's very useful.
You could actually know, Nick, right, that one room is insufficiently cleaned or is sufficiently cleaned before your cleaning crew left.
Right. Yeah. So that's the benefit. You could go back and say, hey, kind of like, we're having our trees done right now, because what else are we going to do? We're at home. So we're having our trees done. And I've gone up there at least 2 times in the past 2 days saying, no, that branch needs to be recut or whatever. Same thing. You can go back in and say, well, we took this swab and it's showing that it's still dirty. So go back and make sure while you're here, it's a lot cheaper to have you do it while you're here than it is to have you come back out.
And it's a really good measure of progress towards or measure of your cleaning process. So if you have cleaned something, you can go back and test that particular surface, and probably in more than just one spot, depending on what the surface is and what you're doing. So you have multiple spots and not just one tiny corner of the desk. But it is a good measure of the technique So is that technique working? If you have like a quirky surface and you're not sure if the technique you've chosen or if the dwell time you're allowing is effective or not, this can be a good measure to test it really quick. And then you can say, oh, well, no, it didn't work out. Let's try something different, or let's try a different technique. That will help guide your cleaning process as you go as well.
Yeah, very, very good point.
And it doesn't tell you what type of bacteria are on there. It just tells you if it's sufficient, like, hey, it's 60%, or how does it tell you?
Right. So it'll give you back a number, and it's based on a relative light unit, and that's what we're doing right now is we're comparing it to the standard for a surgical room. So if it's clean enough for a surgical room, it's clean enough for an office atmosphere is what we're banking on right now.
Most of these things were developed in a hospital setting for obvious reasons. If there was effective disinfection in a NICU or a surgical room, and there are all different recommended levels for those things, which a whole different world of disinfection. But meanwhile, we're in a whole new kind of world of wanting to make sure things are effectively sanitized. So it's a cool tool, and there is a fair amount of research on this from hospitals and from other industry groups. And so, you know, it is not a direct calculation to the virus or anything else, but we feel like it's a pretty good secondary indicator if we're getting where we need to be or not.
Right. So at the end of the day, if you ask us to have some, or even if you don't ask us to do this, if you're doing a documentation of that you've disinfected your facility, you know, you want to have some sort of documentation that you've done it. So we'll provide a report that says these are the products that were used, this is the dwell time we banked on, this is the PPE we used, and, you know, take pictures all along the way and document, so that if you were to have an employee get riled up or concerned about the situation, or a family member, whatever it is, that wants to see this and prove that you've disinfected, you'll have a nice squared away document that you can show.
And this just gets back to the hard truth of opening the country up over time here, is that, and we talked a little bit about this, it tends to be the people that are more problematic probably than the surfaces, but you want to have some coverage, at least that you had a plan and that you executed that plan to the best of your ability, because there are going to be people that are going to get sick, and we're not going to be able to trace everything back to where it came from or how it got there or anything else. And so I think back to Nick's quote from Benjamin Franklin, you know, an ounce of prevention can be worth a pound of cure at some points, when you can produce exactly what you did to keep those employees safe, which again, I go back to, that's the whole point of all of this stuff, is how do we keep the employee safe, keep them in a work spot that they need to do that job, and how do we, you know, effectively get this moving back in the right direction without getting people sick or dying or overwhelming a medical facility. I mean, that's really the name of the game, and hopefully the planning and the prevention part will, and mitigation part will come into clearer focus as we get moving on that.
I think I'm done with this slide. If you want to advance.
Okay. We hit 2 at the same time. Oh, so that's it. I don't even have to say, hey guys, we're running out of time. This is awesome. So if anybody is, thank you guys for your time, and it's great information there. And I'm sure that we just scratched the surface, because there's going to be a lot of uncertainty and a lot of, you know, what do we do? And I'm sure there's a lot of people that are saying putting plans in place right now, and they're going to need some guidance. So just thank you so much for your time and putting all this together. But if you guys are wanting some more information about how we can possibly help you with our services, we actually created a COVID-19 service on our service page. It's on the homepage. But if you want to get down to the breakdown on each and individual services, there's a web page that wh-n.com/services/COVID-19. So with that, I want to thank my expert guests on their time and coming on. And please, just anybody reach out to us if you have any questions. And thank you guys for joining us, and have a great afternoon at home.
Thanks, Lance. Thanks, Conan. Thanks, Lori.
Conan's not on here, you crazy boy.